I have struggled with depression since I can remember.
I just felt like I was just falling and falling.
At that point, the whole world just basically caved in.
It kind of feels like you don't matter.
Whenever I was really lonely, it just kind of felt like nobody cared. I thought it would be better just to end it.
I tried to kill myself.
I actually tried 4 times.
I tried to overdose on pills.
I have attempted suicide once.
I tried to overdose.
Last year, I had a suicide attempt.
You see cancer ads on TV. Where's the advertisements for trying to get people with anxiety disorders help?
Just because you're crying doesn't make you a weak person.
I don't know a kid that hasn't dealt with anxiety and or leading into depression.
We need to get rid of the stigma around not being mentally healthy.
As a young child, Jerron Moore knew he was different than his peers.
When I was in 3rd, 4th grade at late elementary school, I'd say I was full of everything. When I say that, I mean full of life, full of energy, maybe full of crap. I really had no self-esteem, like I was kind of fat back then, I just felt like I didn't fit in anywhere. I had bullies, I had bullies for a little while and I got picked on a lot. I never really got to play, I was always the guy sitting there watching everybody else play with the teachers, just sitting there, So I wrote a suicide letter. And I don't know, I don't even want to talk about that. It was crazy. I just felt like nobody really cared about me, but I was wrong. My mom cared, my grandma cared, my family cared. I got a therapist, and it helped a lot.
Jerron was fortunate to have his mental health issues diagnosed at a young age. His struggles are not unique.
Mental health affects us from a very young age, and we should pay attention to it from a very young age. Very young children, they start looking to express themselves appropriately, to understand the feelings that they're having and what does that mean and what do I do with it, all the way up through each time they hit those developmental levels.
Nearly 1 in 5 high school students will seriously consider suicide in a 12-month period, according to the Centers for Disease Control. 7% will attempt it. Suicide is now the 2nd leading cause of death for those aged 10 to 19. And the teenage years can be stressful, perhaps even more so nowadays, affecting students of all races and all economic levels, including those at relatively well-off Freedom High.
I'm taking 3 AP classes, which has a really large workload.
Social media, that's one huge thing. That really takes a toll on a lot of us.
The deadlines that we have, things that we feel obligated to accomplish.
Mental health got put on the back burner, unfortunately, and it shouldn't have.
I have grown up with depression and anxiety.
Molly Cammerdiner is a recent graduate of Freedom High, now in college and doing well. It was a school guidance counselor who first realized Molly could be suicidal and told her mother, Kim. Molly was in 6th grade.
I was just shocked. She totally floored me. She said the reason Molly would be the one kid that you really have to watch is because she was very popular, great grades. Nothing pointed to issues with Molly, nothing stuck out, except she was always sad.
Therapy helped. Molly has never tried to hurt herself, but she says she hit rock bottom in 11th grade.
I wasn't doing my schoolwork, my grades were dropping, and I care a lot about my studies, so it was really difficult. And then more emotionally, I got hit pretty hard, and sometimes you come across like everything's completely fine, and there are days where you just want to die and you feel really, really bad, and no one can see it. And you're waiting for somebody to see it.
I was shooting heroin every day. I was doing it behind my mom's back, my family's back. That summer there should have been a dozen times where I should be dead.
One of the things I really thought about when I was feeling suicidal and things were like, what would Owen do without a big sister?
To see her cutting herself and just wanting to hurt herself, yeah, it's really hard to find the words to explain.
I think a lot of people feel that mental illnesses are something we make up in our minds.
It's not necessarily that something's wrong with the child, it's that they're living a battle inside that is like so much bigger than anyone can imagine.
I think that old saying, it takes a village, rings true.
We all add value to this process, and as we all work together, that's when we can make the most powerful difference.